Hello viewers, welcome back to my channel Manas, a Pursuit of Happiness, and this is your Dr. Chitra Aravind. So in continuation with our previous videos on mental health series, today also we'll be looking into a very important aspect, that is the signs and symptoms of various major mental health issues. And this kind of awareness is not available among many people. Because of this lack of awareness, a lot of repercussions are happening, and it's having a various impact on a personal life, family life, as well as a work lives. And also people are not living up to their potential because of these aspects, which are diminishing their performances and also their happiness. So we need to look into these symptoms. Only then we can also gauge ourselves and analyze ourselves if you have these kind of symptoms, or also into your loved ones, so that you can seek help when it is not too late. Okay, so the signs and symptoms what I'm talking about is really vast. So I'll be giving you a link into the signs and symptoms of mental health issues, which is given in my website in this video. Please have a look into it. Here I'll be highlighting the very important signs and symptoms of mental health issues. Okay. Now, like physical health, our mind also can get unwell. Like physical health issues, where body can get unwell due to various diseases and various infections and accidents, etc., etc. Similarly, our mind can also go unwell because of various reasons. Especially in this decade, we can see lot of rise in mental health problems, and the government is going to deal with this kind of increasing mental health problems shortly also. Because we could see a surge of mental health issues coming up, and lot of students resorting to suicides, and this is especially very much seen in this decade, I would say. So, but why this decade it is happening? The reasons can be many. Because unlike last decade, there is a lot of differences and phenomenal differences happening right now. Because we could see the rise of dual career families, and also lack of joint family setup, because of which our children are not exposed to the elders and their moral values, and all that is missing nowadays. And also because of various other factors like modernization, globalization, and the thin line between what is right, what is wrong is also getting more blurred. Because of various reasons, this mental health issue is going to become an order of the day. And one important factor is like also the lifestyle issues, because especially nowadays youngsters are only going to bed by 2 a.m., 3 a.m. This is again a red flag, and this can increase our mental health issue also. So I've just mentioned a very important factors which are relevant, and which can increase the rise in mental health issues in our generation, especially from the 2K kids, we could say. A lot of different trends we can observe in this current generation also. So it is very important that we need to address these aspects. Otherwise, we need to develop and practice all mental health practices, as I have discussed in the earlier videos. Otherwise, you could see this trend increasing day by day, and it is a very dangerous trend as well. So how can we solve this problem? Is to understand the preventative healthcare measures, as well as to understand the symptoms. Because in my experience, in my clinical experience, many times I've observed that people are not aware of the symptoms, because these kind of symptoms is more like our everyday things. As human beings, we have a spectrum of symptoms. So we also normal people also tend to get depressed, tend to feel grief. They also tend to grieve, and they also have sadness and joy. Everything as a human being, we all experiences all these kind of things. So it is very hard to differentiate when it is a real mental health issue and when it's nothing to worry. So I need to differentiate this. Only then you will understand when it is actually a red flag, and when is the right time that you need to take some steps towards this mental health issue. So in this video, I will be focusing on major mental health issues like anxiety, depression, and some neurodevelopmental disorders in infants as well as children. And also a few mental health issues which you could figure out in adolescence. Because this mental health survey and the researchers have found out that most of the mental health problems start in the childhood itself. By the time you are like 16 years old, and by the time 24 years old, even the rest of the mental health problems starts to show up. So in these early ages, we need to be really careful about, especially this particular video will be of use to parents also, to figure out whether your children are showing up any signs of mental health issues, because it's very hard to differentiate. And again, I'm going to give you a warning that just because I'm telling you some symptoms, please don't relate it with what you have or what you experience or what your children have and immediately label yourself with that disorders. Only a trained practitioner, a psychiatrist or a psychologist are supposed to give a right diagnosis of a mental health problem. This video is just to give you some awareness about what could be the symptoms, and that could be an alarm factor for you to seek help. If you have some doubts, only when you seek help you know whether you really have the problem, and then you can go for treatment. So with this warning, I would like to go to the symptoms. The major symptoms in a cluster, I would say, it would start in a confused thinking. So a lot of confusion in your thinking process and lack of concentration and attention, all this we can call it as a lack of cognitive functioning. A deterioration in a cognitive functioning could happen, lapse of memory and concentration. So all these things in the cognitive arena. And how about emotions? And when it comes to emotions, a person could start feeling more emotional in terms of irritability, anger, and a lot of crying spells, and feel more intense sadness. And these emotions can be very intense, not like the emotion what a normal people would experience. And in terms of your lifestyle, people will find it very difficult to go to sleep and sustain their sleep, and they may get up in the middle of the night or have some bad dreams, especially in children and adolescents. You could see this thing. And also when eating pattern also, they may tend to eat more, or suddenly they stop eating. And in sleeping pattern, you may start to sleep more, wanting to stay in the bed only and always feeling tired, or you may sleep less or develop insomnia. And also you may withdraw from people. You may start withdrawing from people and feeling lonely. And also the one more important symptom is also suicidal tendencies. The thoughts, in the thought level, you can develop that why should I live and what is my purpose, and start feeling very hopeless and start feeling more inferior. So these are the major symptoms, I would say. Other symptoms are like, you may be having some deviant sexual functioning, and you may develop a loss of sex drive. This is also one of the symptoms, and for various disorders actually. And one more important hallmark symptom of schizophrenia is, like as I already mentioned in another video, is delusion and hallucination. You start hearing voices, and also you start hearing, start seeing images which is actually not present there, and also develop a paranoid tendency that people are out there to kill you. So all these kind of symptoms also may show up. And excessive fear and feeling panicky, your heart rate going up, and excessive worries, and also about you're not interested like earlier, how you earlier used to be. Like maybe you're a person who's like fond of movies and all that, but off late you're not getting interest in those areas of life, and typically not interested in anything. And also one more important sign and symptom of anxiety disorder is over cleanliness and to following hygiene practices in a more intense proportions, like taking bath for 30 minutes to 1 hour in a particular way, following some orderliness in a more intense and extreme ways, and cleaning and checking habits, which is like not very normal. Even every people do, but when it is more intense and frequent only, we say it is a mental health problem. So likewise, I can keep on talking about lot other symptoms. These symptoms what I mentioned are very important symptoms and very common symptoms, I would say rather. So if you could find these kind of symptoms and deviations in a way you think, feel and behave, it's time to get that alarm in your head and start taking steps towards meeting the mental health professional. And about which mental health professional and how to contact and when to contact, I'll talk about in the next video. So here you have to understand like what are the symptoms which qualify you for even going and having a checkup or going for a diagnosis, and to just figure out whether do I really have some mental health issue or not. So when people have this spectrum of symptoms, you need not worry also. Every normal human being go through all the symptoms at any point of their life because of various incidents. Even a student who has failed the test would definitely worry about it or overthink about it or feel sad about it. It's completely normal. But if these set of symptoms are more intense and more frequent and more consistent over a period of time, that is where you need to worry. And mostly in children and adolescents, the kind of symptom what you could see is like they may start refusing to go to school, or maybe they would have got good grades earlier and now there are falling grades and the grades they are failing. And they start developing some peculiar behavior and interests, and they are no more interested in their usual things, and they start detaching themselves from their friends. So all these activities can be a signal that your teenager or a child is actually deviating and starting to have some mental health issues, and they may suddenly cry a lot, or they feel more talking against you, or they may be more defiant to you. And these kind of symptoms also may show up, and they may start experiencing a lot of relationship problems. They may not have any friends at all. So these are the symptoms to watch out for. And what are the kind of symptoms you watch in infants, or the kids who are like less than 5-year-old? Here again, you need to see their developmental milestones. So their neurodevelopment milestones in terms of their social maturity, social development, and intelligent development, and emotional development, everywhere they'll be lagging compared to the normal children. For example, a child has to start speaking and saying few words at least by 2-year-old. But if they are delaying, there might be a delay in the milestones in terms of speaking, or motor development, or maybe in the way they are like connecting to friends in their social development, or in their emotional development. For example, they are not having eye contact with you, and they are not smiling, they are not saying bye to their family members, or they are not showing any kinds of social interest. So these are some telltale signs of some mental health problems which you should be aware of, like learning disabilities, which can also show their hallmark symptoms even before the child is 5-year-old. But then don't panic when the child shows just one of the symptoms what I'm talking about. Only a trained mental health professional can actually give a right diagnosis about these kind of symptoms. But all these things you should be knowing, only then you can get treatment at the right time. And about mental health issues and symptoms for people from the right from the childhood until the adolescence, I myself have written a book which is in Tamil actually. So I'll give you the link in this video, so you can go fetch that book to understand more about disorders which happen in the childhood until adolescence. And after that, there are a lot of adult related mental health disorders also, like schizophrenia or mood disorders, bipolar disorders, where for sometimes they'll be having this elation mood, mania, where they'll be talking a lot and all that, and there will be a depressed stage where they withdraw from people, cut off, feel sad and depressed. So this will be alternating also. So these are major mental health issues which I've shared with you, and there are various other issues, more than even 250 mental disorders are there, but this kind of symptoms are the very major symptom which you could see in various mental health issues. So by understanding this symptom itself, you can just get some idea whether you or your loved ones are having some mental health issue. So like I already told you, our mind is also vulnerable very badly, because when you go to school you're bullied, and when you go to college again you have to sustain lot of academic pressure. And as I already told, we could see a lot of students resorting to suicides, which is a very, very bad sign that our children are actually not mentally healthy, and what is happening to our education system, and what kind of academic pressure we are laying on our children. And this very clearly say that we are not raising a mentally healthy population. So definitely these people are not resilient, and high time that we need to raise our children who are resilient and mentally tough, who can stand and withstand all this academic pressure and all the pressures which they are going to face in terms of relationship or finance or personal life. Anywhere, any kind of problems may show up in your life, but how are you going to react to that or respond to that is still in your hands. That depends on your positive mental health. So in my previous videos I've spoken about how to develop a mental toughness called resilience also. Please go through such videos to make sure that your children are mentally tough in future also, so you can at least prevent them from developing this kind of mental health issue. Even then, if they developed also, there are a lot of treatment options which are available, which can help them to live a more happy and satisfied life like any other normal people. So about which, whether to reach out to a psychologist or psychiatrist, and what is even the difference between both, I'll be addressing about all these important issues related to mental health in my forthcoming videos. Until then, bye and have a nice day.